What in your arena is working to advance health equity? What isn't working? What has to change? Are you trucking for the universe of organizations like you? So I don't think this is about you. What are the choke points in making change and moving us all toward greater partnership and collaboration toward health equity? And what do you think are the levers of change? Small question. We'll start with you.
Great. I don't know if this is on.
We know about you.
Good afternoon. It's Ellen Sexton from United Healthcare, and as I mentioned, I'm the CEO of the Medicaid plan. And I had the opportunity, I've been with United Healthcare for 16 years, and in August of 2016, they came to me and said, would you like to go run a market in the Medicaid space? And they listed Wisconsin as one of the options, and I jumped at the chance. Because I was born and raised in Wisconsin, from Madison, and to come back home and be able to serve my home state, I knew would be incredible. And now that I'm back and doing what we're doing, I can't even tell you how much I know I'm in the right place. And I think somebody mentioned it before that had been away for a while. When you come back, it has changed. And it needs a lot of our attention, and there's so much that we can do together. So when you think about United Healthcare, and what I'm going to take away somewhat from this session is when different people up on these panels tried to talk about us, they struggled a little, right? So somebody kind of tried to say, well, insurance, and it didn't totally come out, and Dr. Gunn talked about some of the work we were doing and referenced us, and she kind of stumbled, well, are they a payer or what are they? And what I say is we're part of the solution. Wherever that is, whatever it might be, we've got the data, we've got the stories, we're working with the members, with the patients, we're working with the providers, and so we're right there part of that system. And so one of the things, of course, when we think about this and we think about beyond clinical care that really matters is people's housing. And so a couple of the areas that we've gotten involved in is first in affordable housing. And last November, we invested $5.6 million in a community in Madison called the Flats, and it's for affordable housing. And then in February of this year, we invested $6.3 million in Walker's Point. And sometimes people look at me and say, well, why would you get involved? And of course, this room knows, right? We can bring affordable housing to a community, and at Walker's Point, part of it is set aside for veterans, 14 of the units. And it's actually wrapping care around these individuals that have struggled with homelessness, getting them back on their feet, and completing a lot of assessments, helping them and getting them back to a sustainable part of society. One of the things also that I think has amazed me is thinking about housing and even the reaction of our own organization. So one of the beauties about being part of United Healthcare, so you're looking at me and saying, well, how could you have invested all this money in these different communities to build affordable housing? Well, it's because we're part of a bigger organization. And so as part of the bigger organization, they have been investing in different markets in Arizona, in Michigan, and there's a model that we have, and it's called My Connections. And it really is about bringing affordable housing. And so, of course, I moved back to Milwaukee, I see the need, and I wave my hand and say, oh my gosh, we need it here. And I'm gonna tell you, I got told no. And I went back to my team and I said, we're gonna figure out how to get to yes. And so in a couple months or a couple weeks, I'll cross my fingers, we are gonna be looking at some of our highest need individuals that are in the ER, that are costing $150,000 a year, and we're gonna be putting them in housing and subsidizing it. Because why? Well, first off, it's the right thing to do for these individuals to help them get their health care back where they need to be. But second, did you just kind of hear the financial part of it? And so if you're thinking about the funding streams, it's pretty easy math. $120,000, $150,000 in healthcare costs, and strain on the system and stress in their lives. I mean, we saw the human anatomy with the stress on their lives. If you can change that with subsidization of rent of $10,000, pretty easy. So those are some of the things that we're thinking about in a different way. Yeah, I just used the word stress. So you asked, like, what are some of the chokeholds, and that's a hard word for me to even say because I don't like to think about it like that. But even today, when I think about all the different organizations and all the people I probably don't even know in this room that I should know and I should be connecting with, and I think about the teams that I have that are here present. So we have this, and I don't know if many of you know, but on the other side of the Italian Community Center is a session on the opioid epidemic. So I have some of my team that's at that. And then, oh, by the way, we're hosting Innovation Day at our office today, right? Carving out time to be innovative. And so I think about one of the words that a lot of people have used is fatigue. And how do we make sure across all of us, we're thinking about those connections, being able to focus on the right things, and being able to connect without creating kind of this stress across the system that you can. I think the other thing, and I don't know if Chris did this intentionally or not, but one of it was, ZNA versus DNA, and he was talking about zip codes. When we started to launch our housing project and our My Connections pilot, one of the things that we wanted to do were using Z codes. So if you're a physician or a provider out there and you don't know what Z codes are, please see me later. These Z codes are within our system, what you can use as far as codes to give us information about the social determinants. So that's the technology, that's the connection that I think if we can make, we can move the needle so much faster. And so ZNA, Z codes, maybe it's the last letter of the alphabet, I don't know, but it's something that we've got to get to and we've got to use because it will definitely help us. And so I think one of the things, you look across this ballroom and what I wish is even in our society, we had this balcony that we could look up and we could actually see the different pockets of work that's going on here and going on there and being able to connect it better because I think that'll really help us get to what we need to.
Thank you, Griselda. You probably are the person on this panel who's closest to the business community. And so in your comments, it would be wonderful to hear you talk a little bit about how we partner with some surprising partners, maybe groups and people who are not here today.
Yes. So my name is Griselda Aldrete. I'm the president and CEO of Hispanic Professionals of Greater Milwaukee. And so it's a nonprofit, and our mission is twofold, is we're trying to get more Hispanic students to graduate from college with a career path. And we have 11 student chapters across the region. And subsequently, we also work with those individuals working within the business community and other nonprofits to get them to move up within our community. It's been kind of referenced that the political clout and the mood around the country hasn't been as favorable to the Hispanic community, specifically with talks about really dividing two countries. And our job, it's kind of multifaceted because when you think about education is the universal equalizer for a lot of us, and it is a gateway out of poverty. For a lot of our students, they go back into the same neighborhoods that are plagued with violence, poverty, and trauma. And how do you then reach another community that right now faces deportation? A big chunk of our students are also DACA students, or they are children of parents who are undocumented. So when you talk about health, and it's not just health-wise of your body, it's the mental health component. It's how do you give someone hope to continue to strive to be better in a country and in a community that's not always welcoming. So what we advocate for is to empower these students and professionals to have a voice. And I think our job has been to foster collaboration across sectors that probably aren't always talking to each other. And so I'm sitting in a panel with individuals that I consider friends and colleagues, but that really have their hearts in the right place to really make a difference. I think it's no secret that Milwaukee has been a segregated community and continues to be. And all of that trickles down if people at the decision-making tables aren't actually willing to listen. My job has been to advocate for a community that is sort of been ignored, but has been here. It's no secret that by 2050, we are set to be the largest population in this country. And the fact that we don't still represent seats at tables of power is alarming in 2018. And so our job has been really to foster and get the attention of the business community, of the largest nonprofits, and also the legislation that makes laws for our community that we think has a voice and should continue to have a voice. Our students sometimes are afraid to go to campus because of how they are treated. And I think that we advocate for the safety of all community members, and it's not just the physical body, it's also the mental state that then will prevent someone from actually wanting to do change. And so what we've also done is begun to do some national work to draw some attention to the work that not only HBGM is doing, but other organizations around the country to bring some funding into this community that isn't always here. And so we talk about going to the White House and having opportunities to have a larger, broader conversation and bringing other nonprofits around the country and businesses that could be doing investments here. I think that's been a little bit more of the work that I've been tasked to do. I've been with the organization 6 years, and I'm proud to call Milwaukee home, and I will continue to do the fight to make sure that our community has a voice.
Hector, you have worked in so many different kinds of positions that really speak to the centrality of healthcare. You cut your teeth as a direct service provider. You've worked at multiple levels of government. You are now working for a statewide social service agency. So you've got the county and the state and the neighborhood perspective. Could you say a few sentences about how you use all of those perspectives to inform what we're doing today and to address health equity on women and social services?
Thank you. I'm very happy to be part of this panel and really this summit. It's been an amazing summit with great speakers, so thank you so much for having me be a part of this. So my experience with government, I think, has been very helpful, especially in this role. I see the social services sector really as an extension of government, many years, and we're partners to really help them meet their mission. Many years ago, governments have moved towards privatization of services, and they partnered up with the nonprofit sector to provide those important services in the community. One thing that didn't happen, though, along with that partnership, is really the funding that we really need to provide these vital services to our community. So the contracts haven't increased at a rate of inflation in such a way that allows us to really provide those services with high quality and high care. Now, on the one hand, the nonprofit and social services sector has the ability to draw down or fundraise and bring on other revenue sources and innovate and be a little bit more nimble. But clearly, there continue to be challenges on the funding side. In my experience at the county, we worked very hard to try to be more efficient and effective with our resources and our service delivery models. We did turn deficits into surpluses, and that allowed us to reinvest back into our providers. Our providers were very happy about that. Certainly, we didn't cover increases that in some cases weren't addressed for up to 12 years, but we made a difference. And I think that that's something that counties and cities and states that we work with need to just be mindful of, that we are there to really help them provide, to fulfill their missions. When I was at the county, we were also moving towards performance-based contracts. And this is something that we felt was very necessary. There's very limited resources that are available to help us improve outcomes and serve our people and improve health and well-being in our community. So we got to make sure that the contracts that are being delivered are delivered with high quality and outcomes, showing value, and also return on investment. Now, as President and CEO of Lutheran Social Services, I think it's the right thing to do, and we stand committed at working with counties and with states to provide that high quality, to try to articulate our return on investment, and to really show that we're improving the health and well-being of our community.
And Michelle, I think you've been in your job now for 20 years?
22.
22. So you have been focused on geography and population. I'd love for you to talk a little bit about health equity and people in place.
Could you say
Everything else I know you're going to talk about it.
Yes, I've been the CEO in the Clark Square neighborhood that Katie Pritchard highlighted earlier. And one thing I see in my 22 years of experience is what economic development can do for a community, and targeted investments like the Zilber Family Foundation, how it can lift. We've had over $12 million invested in infrastructure for a community center, for a Packers football stadium, and now working with the county parks and renovating Barron Park for our Felix Mattia Little League. But what that physical infrastructure does, it becomes a catalyst that helps move the needle on public safety, on beautifying the neighborhood, and creating close collaborations like we have with Clark Square Neighborhood Initiative. And I know we have Tina Rule, our board president, and Ian Bautista here. And by drawing in other partners who, prior to this, and 16th Street Health Clinic, they are right next door neighbors, we have been able to draw in partners who may not have chosen to invest. And when you bring in these other partners, wonderful things can occur. And what I see is, in the early 2000s, we had a teen work program. We were placing 450 teens a year in private sector employment. The economy was booming. Kids were able to have these first work experiences, and then when the economy turned, our teens were pushed out because adults needed those jobs, and then adults were pushed out because of economics and shrinking businesses. But now we're at a historic point in Wisconsin. We have 2.9% unemployment in the state, which is a historic first. We have over 110,000 job opportunities right now for people, and it's really about jobs, jobs, jobs. Dr. Cooper said this, and Dr. Swain mentioned earlier, eliminating poverty will equal health and wellness. He says it's through job creation that providers have the greatest opportunity for relieving poverty. With jobs, other measures fade in importance. Without them, you need a safety net of steel. And for the first time in my 22 years, it's like maybe our safety net doesn't need to be made of steel. Maybe it's if we can make sure all our people are ready for the current opportunities and the opportunities that are coming. Foxconn is going to have 13,000 jobs. The supplier chain is going to be incredible, of relocation, different Wisconsin suppliers booming. We have commercial real estate people saying some employers aren't willing to expand even though they have the cash because they're not sure they have the workforce. We have the workforce. We have awesome, amazing people in our community, and we need help with them getting to those job skills. And dovetailing onto those job skills is one of the most important pieces is mental toughness, mental health, and dealing with that trauma. Whether you're an adult and the trauma happened as a child, we know that adverse effects, like I think Dr. Gunn was speaking about it earlier, have an impact on any age. And so it's truly important. And if you haven't read Dr. Cooper's book, read Dr. Cooper's. If you haven't read Dr. Nadine Burke-Harris, and she talks about the stream and the ogres and the babies, the deepest well, healing long-term effects of childhood adversity. Having 6 components are so crucial, and that's nutrition, so healthy food systems. It's exercise for both children and parents. It's having sleep. So we talk more about sleep at Journey House and the importance of that as an energy source. We talk about healthy relationships with parents and coaches and teachers and mentors. And then we talk about mental health professionals, which we need more capacity at. And I've been having conversations with the great people on this panel about how can we get that resource, especially therapists who focus on parent and child intervention. And then the 6th component, and all these 6 have to happen concurrently, is meditation. And at Journey House, we have taken that meditation to a whole new level with our partnership with the International Association for Human Values and the Community Building Institute. And because with meditation, you can really get to all those other 6 sources that I was talking about. And health-wise, each of those have a targeted biological impact on our systems. So through meditation, you can get to deeper sleeping, you can get to healthier eating habits, you can get to healthier relationships and exercise, and most importantly, beyond decreasing stress and decreasing those cortisol levels that we heard in the first presentation today, it opens up dealing with that trauma and understanding that you as an individual have infinite possibilities to do anything you want to accomplish. Anything. And it brings that oneness, that we're not all operating in these silos, that we're really one team, and it's that oneness is so important. And we're able this year, for the first time in 22 years, to take someone who had no work experience. We have some young men who haven't even talked for 6 years because what they have experienced in the foster care system, in trauma, to now, not only are they talking, but they're earning over $32,000 a year without overtime and bonuses, and could be set to be earning over 42. We're literally taking people and families, moving them from poverty, from zero or minimal income to over 250%. And with that, because then you wrap in the health insurance and benefits, it raises the health of the whole community. And I think we're at a great window if we all work together, that we can blow the roof off all these negative stats about Wisconsin and Milwaukee and Clark Square and these zip codes, and be the healthiest community that our nation has.
I want to apologize to all of the panelists because I don't mean this to be a trick question, but I have a feeling that I can't think of another way to ask it. Michelle just said you have to do all these things concurrently. You have this comprehensive perspective, and you need to be investing and intervening in a variety of ways. Okay, so I'm going to ask, we'll start here. Question is, what's your point of entry? And where do you think the resources come from to actually do more comprehensive work? How do you think about that?
Well, the point of entry is simple for United Healthcare. It starts with our member, then it goes out to the provider, then it goes out to the community, and so I think about it a circle that just keeps growing when I think about the point of entry and then how it expands. What was the second question?
Well, let me ask a follow-up. How do you decide what to do, what not to?
That's a great question. I think you have to first go back to where's the greatest need and helping to find that. And so I think somebody prior had asked, well, data, who likes data out here? And I'd wave my hand a lot. So I think you start with the data, but I think the other part of it, and one of the things that I love to do at these sessions is not only listen to the panelists, but watch the audience. And every time one of the speakers said, I want to tell you a story, every single one of you went and sat up, because it's the story, right? It's about the people. And so I think if you take it back and ask, what's the greatest need and how do you take it back to an individual personal level, you'll be directed in the right place.
So ours is simple. We try to stick to our mission. We cannot be all things to all people, and we are specifically focused on, like I mentioned before, a community that I think has been ignored for a long time. However, we also recognize the need for all of us to work together, and I think the beauty of all of our organizations is our ability to collaborate and have open dialogue about the things that are impacting not only my community or my business, but all of ours. So when you talk about the point of entry, it's a couple of things. It's the individual has to know who we are and that we exist. If that doesn't happen, then they can't enter our services. So we try to be as visible as possible, but also promote other organizations, because there's things that we cannot do because of our limited resources and our bandwidth. And so it's really about picking up the phone and having that dialogue with someone like Michelle or Hector and saying, like, this is where I'm seeing a need. can you help? And then it's connecting, because I think oftentimes we do get so busy and so working in silos that you forget that the bigger picture isn't just about HPGM, it's really about the broader community. And so for me, it's, we choose to get involved in things that not only promote our organization, but the holistic approach to promoting the healthy space that we all want to live in across the world and across the region. But two is really fostering genuine relationships and collaborations, because when something feels disingenuous even to you, it's hard for you to then pick up the phone and want to ask for help from someone else. So both the individual has to know that we exist, has to be willing to ask for help, but then we really have to decide if we're really going to help, and if that help will not just stop with that one individual, but beyond that. And how do you spread that message that you are a collaborator, you are really looking to help a community, and that it won't stop just when your needs are met specifically?
When I think about this question, I really think about how are we going to position ourselves to improve the health and well-being of the people we serve and the communities in which we serve, and in our case, in Wisconsin and Upper Michigan. And I think about the opportunities to improve outcomes, to increase satisfaction, and also reduce costs. And for us, we want to begin to innovate and figure out new solutions to some of our biggest challenges. And we see opportunities in partnering up with the healthcare system, with managed care, and with insurance relating to the social determinants of health. We know that as a country, as a state, we don't spend much on the social determinants of health, and that's really where it's critical to improve health and well-being in this community. We have a robust infrastructure to be able to partner up with healthcare systems, with managed care and insurance. Many of these organizations are starting to begin to get into this space, and we just want to tell them, hey, we're here, and we can partner up with you to do something really good for the state of Wisconsin. And again, improving well-being, increasing satisfaction, and also reducing costs. In addition to the healthcare partnerships, I think about our school-based mental health program, where it's early intervention, it's proactive, it's in somewhat prevention, and we don't just stop at the traditional school-based mental health approach, but we wrap around the parents, make sure that mom and dad are doing well. The better they're doing, the better the child's going to do. But then also taking that social determinants of health framework with regards to assessment, evaluation, and referring to make sure that these families have a good quality house, to make sure that they're safe, to make sure that they have proper nutrition and are eating well. And if we could connect them to training that'll lead to a good family sustaining job, we want to be able to do that. So those are a couple of things that are on our horizon that we want to work on in collaboration with our partners. Alone, we can serve a child, a family, but together we can transform a community.
I'd like to dovetail on what Griselda said with the phone calls. There's so many times I picked up the phone to call Griselda or Hector and many of others that are in this room. And the beautiful thing about Milwaukee is that we're on a scale where we have these deep, long-time relationships, and that by partnering together, we can move it forward, and we think out of the box. And Hector, in his previous position, we were struggling with this nuisance properties in our neighborhood that were really bad things happening on the journeys of kids to Journey House and our Longfellow School or the Packer Stadium. And at the same time, we had young people who were homeless and aging out of the foster care system, and thought, we can do something about that. And with the leadership of Mayor Barrett and County Executive Chris Abley, who brought Hector in as a partner, we really rethought the system. And with that leadership and looking at the systems, created something really innovative where we got the property for $1. We used our youth build and our construction training to do complete gut rehab and made the most beautiful, affordable housing and restored it to its historic significance. Unanticipated, all of a sudden the neighbors on those blocks, what are you doing? Is that how you do it? Suddenly, boop, 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 the neighborhood starts getting prettier. These young people move in and they're wrapped around through support from Milwaukee County Wraparound, through the programs at Journey House, and now these young people are just blossoming. We have 14 units in the neighborhood and continue to build it more, but that would have never happened without making those calls. Who can come to the table? We don't know how to do this. This is the issue. Help us. And we figure out and make something extraordinary. And then what Hector said about parents, it's all about the parents. We have 100% parent participation in our youth programs, in our adult ed programs as they go through these orientations. We have a motto, to develop our kids, you have to develop our adults, and working with our volunteer coaches, and we have over like 80 of them, and every one of them either wanted to be an NFL player, NBA, or MLB, so, you know, they all think they know what they want to do, but then when you say, oh, we're not even going to talk about the sport, we're going to talk about nutrition, we're going to talk about healthy relationships, we're going to talk about sleep, we're going to talk about meditation, and guess what? All of you are going to go through this program because if the top tier, and this is about leveling the playing fields, if our top tier Fortune 100 corporate titans are doing meditation, professional sports franchises are hiring mental skills coordinator, why can't we do it for our youth and for our coaches and our people? And so that's what we're bringing them. We're giving the same type of experience that corporate titans are getting, and that's what makes anything possible. And it reframes the conversation. Our parents have tools, our young people have tools, you know, to make a difference and make things happen.
One of you has mentioned a program or a couple of different programs that you're using in your organization and in your sector that have proven successful. Here's my next question. How do you scale that up? What's the system change or changes that are needed? Marquette hosted a meeting yesterday for SWIM, which is Scaling Wellness in Milwaukee. And it is a relatively emergent collective impact effort to try and better bring all the people together who need to work together in order to address trauma. Okay, so they're doing a piece as an anchor institution in the neighborhood, but I suspect that there are people in this room who did not know about that meeting. It is a relatively new and evolving piece of work. They also recently hosted someone whose name was mentioned earlier, who I would recommend to you, and that's David Williams, the Dean of the School of Public Health at Harvard. If you go to the Marquette Forum, I'm not a graduate, but this is a great thing to do. Go to the Marquette Forum. There are a set of slides and a videotape of a presentation he did recently on this topic of health equity, and in particular lifts up the role of racism in persistent health inequities. So, having said that, I want to ask you about systems change. He does the same thing in his talk where he pulls out models, but he also talks a little bit about scaling. I'd love to hear people talk about that.
Great. So scaling, that's a broad question in a way when I think about it. So first off, right, thinking about things differently and starting small is the first step. And so I think, you know, across the panel, when you think about it, like if you start with broad system change, it's better if you can give a few small examples that then impacts and helps people make that broader system change because they can relate to it. And I think first, right, it does come back to connectivity and how do we make sure people are aware and connected to the differences you can make in a different way, and technology, right? So we have to leverage that, and I think we get a little scared that why would you do that in this vein? And it's so important. You think about innovation and people think about the next iPhone. Well, we have to think about how it also can impact our societies and change that from a systematic standpoint. So being able to connect back and know somebody that's homeless is now where they're at, what treatment they've sought, maybe what food they've been able to obtain, it all matters, and it helps us to understand where they're at and meet them where they're at. So I wouldn't overlook the technology part of it for how we can scale up. The second does go back to policy and funding and how you start to intertwine that and look at that differently, because I think we've heard from all our speakers this morning that's actually how we're going to make our dollars go further, and the funding is really what we need to start some of those programs and then take them much bigger. So I am a big proponent of, you can talk about things, but you also have to act on them. So ideas, creativity is about bringing ideas, and true innovation is actually putting those actions into place. And so when I talked about our housing initiative before, our next step, right, is sitting down with the policymakers and thinking about how some sort of 1115 waiver can start to say, hey, we can fund some of these tenancy housing. And I intend to do that. And so scaling up also includes policy. And then actually it goes back to the question you said before. If we're going to scale up, we also have to think about what are the things that we've been doing that we shouldn't do anymore because maybe they weren't working, because we can only stretch our resources so far.
Thank you. You know, one of the things that also suggests to me is that we can all get behind Ken Taylor's budget initiative, which of course makes me think about voting and power and privilege and what people might be doing with respect to creating more power for the people who are most affected by these problems. But having said that, Griselda, you do a lot of work in that arena. Can you talk a little bit about your thoughts on policy change and scaling good programs?
Yes. Well, before we get to that, I think we need to have the right people at the table. I mean, if people that are making policy decisions aren't representing the community members that need those changes, then we're probably not going to get anywhere. And when I think about scaling up, I also think about, how do you make sustainable change? Because it's not enough to just say, this is our goals for 2020 or 2050 if the sustainability plan isn't also there. When you talk about policy change, I mean, how do you get people vested in the right issues on a continual basis? And by that, I mean, are we as a society and specifically our city fostering leadership change that needs to be impactful? I mean, I think about succession planning for even just my organization, and am I doing the right job of fostering that next generation of leaders that will continue to carry the torch that we've been doing? And I think before you talk about policy changes, we need to take a hard look at who are the people leading the charge right now, and who is the next wave of the leaders that are going to take the charge. And if we can't name at least 5 people, then we're in trouble again. And I think that's where scaling up is a great way to look at a solution, but unless you have the sustainability plan attached to it and the right people in place and the right line of people, not just today, but 10, 15, 20 years from now, instead of progressing, we're going to be looking at regressing, which is where I think we're seeing across the country is that we're having conversations around racism and inequality and the unsafetyness of our children and schools in a place that's supposed to be a safe haven. But it's sort of like it's a forgotten topic once something else happens the week after. And so it's continuing the conversations and making sure that no child gets left behind. Well, no adult should get left behind either. I mean, you think about the incarceration rates in even our own community. There's 23,000 people incarcerated. 12% of those are African Americans, 10% are Hispanic. What are we doing to make sure that when these individuals come back out into society, that they're going to be, community members that are contributing back to our economy? And I think that when you're talking about scaling up, it isn't just about the business component and looking at the money and just what our organization can do. It's what are we as a community really tasking ourselves to do for everyone involved.
So at Lutheran Social Services, we're actually going through a process right now where are our programs that operate with excellence? Where are we truly making a difference in the lives of the people we serve? Where are those programs that we have a decent margin that could support the viability of our organization? So we're going through that process right now, and we know that we're taking a multi-pronged approach to really help the organization be a much more financially viable organization. So we have a growth strategy on those programs, again, where we operate with excellence, where we have a margin, and we're being intentional about growing all across the state of Wisconsin and Upper Michigan. But we also have a divestment strategy. So there are some programs that don't fit with our strategic priorities as we want to move the organization forward. There are some programs where maybe we don't operate with excellence. So we want to kind of work with our partners to transition some of those programs to other partners that might do a better job than us in that space, and that it's really part of their strategic priorities. We also know to become a financially viable organization, we need to do more on fundraising. Only 4% of our revenue comes from charitable contributions. From a social service agency such as ours, that's way too low. We need to at least be at 10%. That's a huge stretch, but we want to work hard to really get there. And again, we need to diversify our approaches and begin to innovate in the areas we want to get into in healthcare with insurance, as well as managed care. We also, though, need regulatory barriers to be removed. Oftentimes, we're not able to work across silos as effectively as we wish we would, or across programs, or across funding sources because of those regulatory barriers. It'd be great if those are removed. By doing that, we get more innovation, more creativity, and more flexibility to ultimately serve our people better. And again, I want to come back to partnerships. Alone, we can make a difference, a meaningful difference, but together, it's more transformational.
Yes. For scaling, and we get asked this question all the time, but we really have to shore up our internal infrastructure and human resource infrastructure and make that as strong as possible. And then when you look at the organization, so at Journey House with our YES program, which is our meditation and our community building workshop, that's part of the job description. And so really setting the tone as the Journey House culture that this is who we are, and if you want to be part of this team, this is what we do. Because when you come into Journey House, there is a different type of energy. And for those of you who haven't been to Journey House, we're attached to the largest K-8 school, public school in the state. We have over 1,200 kids from age 3 through 8th grade. It's predominantly Hispanic, it's bilingual, it's one of the best public schools in the state in terms of achievement. But they also, the principal and I work very closely together to make sure that their same culture, as much as we can, is throughout the entire facility and building. And they too have adopted every morning starts off with a calming moment, and there are 5 minutes of calming and breathing that happen to set the tone for the day. And so by doing that shift, what was happening is standardization. And I'm on the Frederick Hospital Board too, and I know Monique and some others are here today. But I've learned this, and I knew it, but standardization leads to innovation. And so when you have protocols standardized throughout your organization and system, and then when they need to be tweaked because of this new best practice or innovation, you start getting everyone on the same page. Not only your staff teams, your partners, your volunteers, the children and families we serve, and again, going back to that one team, when everyone is on the same page, great, extraordinary things happen. They happen every day. So continuing to grow those partnerships is the way to scale.
I'm going to switch the order a little bit. Hector, can you pick up the ball and talk a little bit about the title of this program was Reimagining Solutions.
And I recently heard Angela Glover Blackwell from Policy Link speak, and she talked about the need for radical imagination. Now, I know all of you raised your hand saying you slept 7 hours last night. When you don't sleep, and your imagination is going on, what is the solution that you imagine? 1 minute on that.
Okay.
Because we have to wrap up this panel and get ready for the next.
I would say ending chronic homelessness. When we're at the county under the leadership of County Executive Chris Abley, Jim Matthew was our Housing Division Administrator. The state, the county, HUD, many organizations in this community really stood up to do the right thing for the chronically homeless in Milwaukee County. In 2 years, while I was there, we housed 200 individuals, and 99% of those individuals remain in housing, where on average prior, they were homeless for 12 years of their lives. 77% of these individuals have some form of income where before they had zero. 27% of these individuals are now working and contributing to the rent. The more they do that, the more people we're able to help in the program. But the savings are pretty amazing. We saved Medicaid $2.1 million over that 2-year period. We saved our own behavioral health division over $750,000. We have a psychiatric hospital, an emergency room, and other psychiatric services. We saved the criminal justice system over $500,000. We invested about $2 million into this program, but the results are amazing. This only happened because of the robust collaborations we had in place. We'd love to work with United and replicate this all across the state of Wisconsin. It'll save money. It's not only the right thing to do, the humane thing to do, but it's also the smart thing to do.
Let me give the final word to Griselda. You do a lot of work with children and youth to help them gain a foothold on the path to success. And I think we've all spoken today about the importance of starting with kids. So if you could talk a little bit about what your primary solution would be when you're radically imagining what the future could be. And you're going to have fun words.
Oh my God, the pressure is on, right? To be quick and get you out so you can use the bathroom, right? Yes. Really quickly for me is access to quality education for all. And when I mean quality, it isn't just getting them to go to school. It's how do you get them safely? How do you make them feel welcome, that their voices are being heard, that they're being educated in a productive and meaningful way that makes them feel like they're going to be contributing members of society, that will be respected, that they'll be heard. I think that for me is an incredibly important thing, which then correlates to all of the things that we've been talking about, right? Health, the end of poverty, the end of violence, dealing with the trauma that all of us at some point in our life, however you want to define it, have experienced, which then leads to income inequalities, right? So if we can kind of even the playing field, as Michelle has said, education is the universal equalizer. And I think when you talk about education, quality education, you also begin to demystify the stereotypes and the racism that continues to exist for all of the groups that have been marginalized in this country for decades. And so that's what keeps me up at night after I sleep for 7 hours, right? Thank you so much.